The shoulder is a joint made up of a ball and a shallow socket. For that reason, it relies on a lot of structures to help stabilize it, such as the capsule or the rotator cuff. If those structures get tight, they can lead to impingement and pain. These simple exercises will help restore that flexibility you need to get you on the path to feeling better.
Justin's going to demonstrate first shoulder flexion, and he's going to push the towel up the wall and hold it for a second and come back down, perhaps moving in closer to the wall to get a greater stretch. The next step would be to work on external rotation, which is best done at 2 angles. So he would grab onto, first by bending your elbow, keeping it close to your side, and then get at an angle that's comfortable for you, and gradually trying to turn your body away, keeping the elbow bent at about 90 degrees. Should it feel a stretch in the chest area? For external rotation, it's good to do a second angle where he puts his arm up on the wall and drops down to a comfortable position where he's not giving pain in his shoulder, and then rotating out. Okay. For our convenience, we're using this wall, but a corner of a doorway is often a better position to do that exercise in. Okay. So from this position, Justin could reach up and go into abduction. Okay. Abduction is difficult to obtain until you have good external rotation of the shoulder. So he's in a good position to gently stretch without giving himself a pain on top of the shoulder. It's very often a common shoulder problem to have difficulty reaching behind the back, and it is best restored with 2 movements. The first one is extension by reaching back, and he could hold on to the counter behind him and gradually straighten up to increase his stretch if he wanted to. Then one of the most important stretches in any shoulder program is usually involve the posterior shoulder, and that's done in a standing position by leaning against the wall in such a way that the shoulder blade is pressed down and remains against the wall, so that the stretch is in the shoulder and not the shoulder blade winging off the wall. So find a comfortable angle there, perhaps turn slightly in, Justin, and now push on your wrist while keeping your elbow bent at 90 degrees. So again, holding that for 20 to 30 seconds, you could suggest that the patient try a couple different angles to see if there's a particular position where they get more stretch, but he's doing a nice job of keeping the shoulder blade in position. A complementary stretch to this is in the same position where his shoulder blade is against the wall, but instead he brings the arm across his chest, supporting the elbow with his opposite hand, and gently pulls until a stretch is felt. Again, with the shoulder blade on the wall, the stretch is in the posterior shoulder. 20 to 30 seconds. If he were to have some pain, you can adjust the angle to find a comfortable position where you might not be compressing any structures in the anterior shoulder. Another example of a flexibility program for the shoulder can be done using a table. The first motion is for Justin to reach out in the plane of flexion, and he would gradually roll back and get to a point of stretch and mild discomfort, and hold that for a comfortable period of time, at least 10 seconds, possibly longer, and roll back again. He would do repetitions. The progression for these exercises would be then to work on external rotation. And external rotation, he's going to position his arm at the 90-degree bend in his elbow, and then bend forward at the waist. And again, hold that for about 10 seconds. Going forward. Good. And what he's looking to achieve is that his arm is getting flat with the table. All right, good. And then to follow that with reaching out to the side, this is in the body's plane of abduction, and he would probably then roll the chair away from the table. Good. And then come down. Get close to the edge of his bed and allow his arm to stretch back. Let gravity pull there. Going to increase his range of motion in extension. Sometimes limited extension will come into play for people who have difficulty reaching behind their back. So this stretch, combined with what has been named the sleeper stretch, if you slide over and roll onto your side, okay? So Justin will put his weight back slightly so that his shoulder blade is held down, and position his elbow bent at 90 degrees and below the height of his shoulder, and then gently push down on his elbow, on his wrist, keeping the elbow bent until a stretch is felt in the back.